Breastfeeding basics for new parents. Common breastfeeding challenges and fixes. 1. Positioning. Support baby's head and back. Let your chin touch the breast, but keep the nose clear. Don't push their face in. 2. Baby can't latch. Try gently stretching the nipple daily, using a pump to draw it out. Massaging the areola. Letting a partner help stimulate the nipple. 3. Cracked nipples cause shallow latch. Fix. Make sure baby takes in the areola, not just the nipple. Apply breast milk after feeding and air dry. Avoid tight bras and rough towels. 4. Nipple confusion. If baby starts with bottles, they may resist the breast. Solution. Offer both early to build flexibility. 5. Oversupply. Signs. Baby chokes, spits up, or pulls away. Fix. Use a scissor grip to slow the flow. Don't pump out for milk. It's rich in nutrients. 6. Feeding frequency. Newborns feed 8 to 12 times a day in the first 2 weeks. By 3 到4 weeks, 7 到8 times a day. Don't feed every time baby cries. Learn to spot true hunger cues. 7. Should breastfed babies drink water? Nope. Breast milk has all the hydration they need. Extra water can stress their heart and digestion. Exceptions: fever, diarrhea, or extreme heat. 8. Baby feeds in short bursts. Could be low milk supply, hard nipples, or bottle flow too slow. Fix. Massage breast to help flow. Use soft, fast flow nipples. Gently wake baby to continue feeding. 9. Baby rejects the breast. If baby starts with formula, switching can be tough. Solution: be patient. Offer the breast often and avoid formula when possible. 10. Don't lay baby down right after feeding. Hold upright and birth first. Watch for spit up or choking, especially at night. 11. How to know baby's getting enough milk. Milk supply works on demand. The more baby nurses, the more you produce. Signs baby's well fed: 6到8 wet diapers day, 2到5 poops day. Weight: 200到300克 weight gain 每 week. Baby looks alert and skin feels elastic.